Skin discoloration or hyperpigmentation is one of the most common reasons why people come to see me. And before I ever make any recommendation about skincare, and I think this is what everybody should do before they attempt to use skincare to help with their issues, is you need to tackle two things when it comes to skin discoloration. So if you're pigmented or melanated, then you may not know this, but whenever you experience some form of injury to your skin, your melanin is going to hyper react because it thinks that you're getting UV damage from the sun. Okay, so that's why you get hyperpigmentation. But there are two main things that you need to do to make sure that you can get rid of skin discoloration before you even add any sort of skincare products. So the first thing is that you need to keep cortisol levels low. So when you're stressed, it could be because you're having trauma issues, mental health issues, work stress, relational stress, whatever, not sleeping enough. When your cortisol levels are high, it affects your ability to heal. Okay, so we know that hyperpigmentation is a form of scarring. And so if your body is in a chronically stressed out state, you're going to impair your ability to heal. And so I always ask my patients about stress, and they're like, oh, blah, 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 blah. But I'm like, no, seriously, like, tell me about your stress, because if you're not handling stress properly, and if we're not looking at all the different avenues that lead to cortisol increases, then you're not going to be able to get your skin to heal properly. Okay, and so you might find that one person has hyperpigmentation but they clear it really easily, versus somebody where the hyperpigmentation just gets stuck, and it has to do with your ability to heal. And if you're pre-diabetic or you have insulin resistance, this is going to be very, very much impaired. And so whenever I talk to patients and I look at their blood work or I look at their history, if there's any indication of insulin resistance, then we need to talk about dietary changes and managing lifestyle, in addition to what we do in the office to help with your hyperpigmentation or your skin discoloration. So that's the first thing. And the second thing is going to be making sure that your vitamin D levels are optimal. Again, melanin, vitamin D, they really work hand in hand, right? And so if your vitamin D levels are low, it also is going to affect your immune system, just the same way that when you have high cortisol, it affects your immune system. So those two things need to be optimized. Your cortisol needs to be low, your vitamin D levels needs to be optimized. You can either take supplementation, or you can make sure that you're always outside in the sun, which can be difficult, especially now that we're going into the colder weather. But those two things are the best things that you can do for your skin to prevent skin discoloration, or to help with managing skin discoloration naturally. And then you can add skincare products that help with skin discoloration. So you can add things like kojic acid, which is going to help with, it's a tyrosinase inhibitor, so it's going to help with issues like hyperpigmentation. You can do hydroquinone if you're working with a doctor. You can do niacinamide, you can do retinol, so all the different things that help with pigmentation. But that should not be your first go-to, okay? It should always be keeping stress low, so keeping cortisol low, and making sure that your vitamin D levels are optimal.